Carpal tunnel is an entrapment of the median nerve at the wrist, and basically it causes typically numbness and tingling and the hand falling asleep. Symptoms are mostly common at night, where it wakes the patient up and they have to shake the hand to get rid of the numbness and tingling. In the beginning, it could be very mild, and slowly but surely it can cause more permanent numbness, and towards the end it will cause muscle weakness. It's very important to make the diagnosis early on to prevent nerve and muscle damage. There are several types of treatment. First of all, we need to know the cause. If it's caused by machinery or work setups, we need to fix those so that they don't damage the nerve. It could be much more frequent in patients with diabetes or diabetic neuropathies. It's more common in women, and usually it would require early treatment with wrist splints to prevent the nerve from getting more damage. If these don't work, usually healthcare professionals will resort to injections, typically steroid injections. But more commonly than anything else, the thing that will really get rid of it, if you don't get rid of the cause of it, such as machinery and work, and in construction worker, typically surgery will cure it. Well, carpal tunnel could be confused with repetitive strain damage. In other words, if you do a lot of machineries or graphics work with the hand, and right-handed people in the right hand and left-handed people in the left hand, if you do a lot of that stuff, you might have symptoms that might be confused with carpal tunnel. And the typical thing at that point is to do an EMG study to make sure that it's not the nerve that's causing that. Other causes include trauma and damage to the nerve that are not specifically located to the wrist. Patients with arthritis are more likely to have carpal tunnels. Typically, it's more common in women. Typically, it's more common with manual workers.